have a lecture about ultrasounds today. It's a catch-up lecture. It's the first one that we did um, for our ultrasound series. So that's the one that we're going to do now. It's actually basically two videos that are quite informative. So what we're going to do is that as the videos are going, I'll stop and give some commentary on what the guys are talking about. A lot of people may ask, well, why have ultrasound lectures? The main purpose is that in the emergency department, you often need urgent, sorry about that, the very urgent imaging, especially in terms of polytrauma, acute respiratory distress, acute cardiac malfunction, hypovolemia, shock states, aneurysmal states, abdominal pain. I mean, anything that you can get from a normal ultrasound is something that potentially you would. Have I brought up the right one? No, I brought up the wrong lecture. Sorry about that. Oh, no, it is a correct one, I think. Okay. Yeah, this is the correct one. Sorry about that. They're just both, I don't know why I dated them the same, unfortunately. So basically, ultrasound can be used in all of these settings to make sure that your patient you come as close to a correct diagnosis as possible. Now, what we're going to do in the next lecture is we're actually going to cover what is EFAST, which is the main focus of ultrasound in the emergency department. But just to let you know that emergency departments, your casualty, wherever you are working, even your GP practice, should you end up there, it's not limited to an EFAST. There's a lot that we can look at on ultrasound that you may not necessarily see otherwise. So the ultrasound is one of the best tools that we can use to actually, assist our patients. So this was done on the 13th of January, not the 20th of November. So my apologies for that. I think it was just a problem with the dating when I was copying the thing. So we talked a little bit about the EFAST, but in all honesty, today we're just going to talk about ultrasound basics. And the first thing in ultrasound basics is knowledge or understanding the machine. So we're going to watch a little video about that. And as the video is going, I'll stop the video. We'll give some descriptions of what's going on. And then we're going to talk about our basic ultrasound physics. So it is a bit long, but if you want to start ultrasound and ultrasound training, this is a good place to start. Okay, so let's get going. And yeah, we can see from there. Just going to try and I think it's going to work with my pointer. Just get that out. All right, let's get it going.
Hey guys, welcome to our video about the basics of ultrasound. We're fourth years, Carrie,
Gabe,
and Julia.
As you progress to your clerkship year, we wanted to give you a brief background in ultrasound so you can look like a boss during any of your clerkships. Our goal is to teach you what each of the probes are for and how to control the basic functions of the ultrasound machine. This will allow you to help your resident while they are scanning and then jump into scanning on your own. To begin, let's go over the different types of machines.
In the ER at UC Davis and at Kaiser Roseville, the Zanare is the machine of choice. VA MICU, UC Davis MICU, and UC Davis OR use sonocytes. The Tower 5 MICU has new sonocytes, which are dual touchscreen. One other type of machine that you might see while on rotation is the GEV scan, which is used at the VA.
now let's talk about the probes. The three most
Okay, I just wanted to stop there for a second. So the one that we actually use is similar to the first machine. That's in our emergency department. But this is just to give you an example of the different types that you can get. So just have an eye on that. But generally, the last one that they saw, we don't normally use in the South African setting, unless you're in a very high tertiary hospital or a central hospital like Albert Litude. All right, let's talk about the probes.
Hey guys, welcome to our video about the basics of ultrasound. Let's go over the different types of
GEV scan, which is used at the VA.
Now let's talk about the probes. The three most common probes that you'll encounter in the ED are the phased array probe, the curvilinear probe, and the linear probe. The curvilinear probe is the lowest frequency probe. Notice where the location of the indicator is compared to the smooth contralateral side. It has a large footprint and scanning area, but the resolution decreases with increasing depth. This probe is ideal for all abdominal, retroperitoneal, and OB/GYN studies. The phased array probe is another low-frequency probe but has a smaller footprint than the curvilinear probe. Again, notice the location of the indicator compared to the smooth contralateral side. This is a probe that is ideal for cardiac studies, but is also used in fast and rush exams or for any deeper exam when the curvilinear probe is unavailable. The linear probe is a high-frequency probe. Notice the location of the indicator compared to the opposite side, and this probe preserves the resolution of the image with increasing depth. The scanning area is limited due to the size of the probe, but it's good for superficial exams including for vascular access, soft tissue exams, musculoskeletal, or venous compression studies. And finally, we have the endocavitary probe. This has a moderate frequency with a small footprint but great resolution, which makes it ideal for intraoral or transvaginal studies.
Now that we've covered probe selection, here's what
So just to let you guys know, the majority of us who work in SA will actually end up with the curvilinear probe. So the advantage of the curvilinear probe, that big curved probe, is that it allows you to look at a lot. It's a low frequency. So low frequency means that the ultrasound, at least the sound waves are passed very far. The problem is that it doesn't give you as clear an image as you would get with a high frequency probe. Now with a high frequency probe, you get a very clear image, but it can't see very far. So in emergency departments, in fact, in the majority of the world, except maybe in the first world, you would use a curvilinear probe simply because each probe is a very high cost, and most public institutions can't really afford it. If you're working in a private emergency department, though, there is a possibility that you may get all three. And if you do, then they normally give you training on how to use those. But and during our time in our lectures, we're going to concentrate more on the curvilinear probe. So let's get back to the video.
you need to know to get started scanning in the ED. First, turn on the ultrasound machine. The on button on the Zanare is located on the lower console.
Okay, this is the one
Next,
similar to
select the
ours.
New Patient button. This is located at the top left of the keyboard.
So I'm just going to skip this part a little bit because normally in the emergency departments in SA, because we don't have an electronic patient database, we normally don't go through this little section here because we don't normally input. But if you want to learn it on your own particular machine, that's perfectly fine. You can, but most of us, because we're working in busy emergency departments, we don't have the time. We normally just physically write on the paper. Should you have a printer? I mean, I know we don't even have a printer.
Now select Probe and Exam Type. To choose a probe, select the transducer button, then select the probe that you want. In this case, we choose the linear probe, and you can see the correct footprint displayed on the screen. Some machines require you to manually switch the probes. In this case, you'll unlock the probe that's currently in use from the machine and switch it for the probe that you want. Make sure to lock both back in place. Now change the exam type. You'll see a drop-down.
Okay, we're going to skip a little bit ahead as well here. So the majority of the machines in South Africa, you do have to remove a probe and replace it with another. However, most of us, because we only have the curvilinear probes, they tend to be already static and in place. The only reason I wanted to show you that was simply because if your machine's not picking up any signal, or you're not getting a decent picture or any picture at all, look at its connection. It may not be locked. We generally don't have these more advanced machines that have all three probes, so it doesn't really make much of a difference. What they are going to talk about now is the different type of exams. So are you doing abdominal? Are you doing chest? I must be honest, as a beginner, most machines come preset for abdominal, so I wouldn't stress too much about that. So it takes up quite a bit of the video. They're just showing you how to apply gel and things like that. Sorry, I just want to come back to this. So this is the crux of what we're going to talk about now. And these are the different functions that you find on your machine. Let me just get that started again.
And controls of the ultrasound machine and where to find them, also known as knobology. Gain. This is a function in B mode or 2D mode, which is normally the default mode. The gain is the degree of amplification of the returning signal, and adjusting it increases or decreases the overall brightness. So
in basic words, gain equals brightness. All right. Just remember that gain is equal to brightness.
Changing the volume on this, your new favorite video. There's also the optimize button on the Zanari machines. This will automatically adjust the gain if an image is too difficult to see. Always try to optimize it.
Next is color. This applies a color scale representing flow in relation to the probe. Red represents flow towards the probe, and blue indicates flow away from the probe. Remember that arteries will not always be red and veins will not always be blue. You can apply color to identify vessels, valvular regurgitation, and ureteral jets. Next is depth. This adjusts the field of view to increase or decrease the scanning area. Try to center the area of interest within the frame.
Frequency is automatically set when you choose your exam type, and therefore you will not have to manually adjust this. Using the measure feature can be helpful in determining vessel diameter, gallbladder wall thickness, fetal crown to rump length, and more. First, freeze your image, press the measure button, use the trackpad to hover over the first point and press set to drop your caliper. Then, use the trackpad to span the distance you want to measure and hit set again to drop your second caliper. The measurement will be displayed at the bottom right of the screen.
Measuring is not necessarily the best thing to learn on an examination such as this, for the simple reason that it's something that you need to do practically. I just want to go just a little bit back. So one of the important things that they were speaking about was depth. So especially when it comes to depth, sorry, let me get my laser pointer over there. So especially when it comes to depth, so no matter what structure you want to look at, always make sure that you can see it the largest that is possible. So you do that by either, either by increasing or decreasing the depth. So if you're looking at a very superficial structure, just decrease your depth. And if you're looking at a very deep structure, then increase your depth as well. Okay. Okay, we're going to get back to the video in a second. Okay, sorry, slight interruption. We just had a bit of light out here, loss of power, sorry. So we're just going to move on to the next slide and the next video. So like I say, most of these things are done best in practice. And so we just want to get back to this, right? So the next thing we're going to understand is just a little bit of ultrasound physics, okay? Just so that you guys have a look. You can see it's a bit of a long video, but I'll try and speak as much as I can. All right.
Cram.com. Okay, well, we're going to dive right into ultrasound physics and instrumentation. And while this may not be the most exciting topic to start off with, I assure you it is foundational to apply ultrasound clinically. And even though physics is in the title of the presentation, do not let that frighten you. In classic MedCram style, we will break down the concepts so that they are easy for you to understand. In this course, we are going to define ultrasound. We will discuss basic ultrasound physics. We'll touch on ultrasound biosafety and the ALARA principle. We will discover different ultrasound transducers and their applications. We will look at ultrasound orientation and common ultrasound terminology. We will explore ultrasound knobology, or the different knobs and controls that you need to know on the ultrasound machine. We will look at the ultrasound modes. We'll discuss ultrasound artifacts, and we'll finish up with a step-by-step guide on how to perform an exam on a patient. Well, let's start off by defining ultrasound. And if this line represents all of the possible audio frequencies that exist, then a portion of those frequencies are audible, or those that can be heard by the human ear. And this is said to be 20 hertz to 20,000 hertz. Well, then everything below the hearing threshold is said to be infrasound, or subsonic. Then everything above the hearing threshold is said to be ultrasound. So ultrasound is simply sound waves that are above the hearing threshold. In diagnostic medical ultrasound, the frequency ranges typically are 1 to 20 plus megahertz that are being used. Before we dive into ultrasound physics, I want to briefly explain how an ultrasound machine works. And while you may not be familiar with an ultrasound machine, you're likely familiar with the speaker. And since they both generate sound waves, it provides a good example. The speaker uses electrical energy, and the electrical waves that travel through the speaker cable cause the speaker to pump in and out. This generates sound waves in the air, which are then heard by the human ear. Well, similarly, the ultrasound machine uses electrical energy. The electrical waves generated by the ultrasound machine travel down the transducer cable into the transducer, and the transducer produces sound waves. But in this case, some of these sound waves reflect off of the patient's tissues and are transmitted back to the transducer. The transducer then, at this point, converts the sound waves that it's receiving back into electrical energy, which is then processed to form a visual image on the ultrasound machine. So let's look at this another way. You have your ultrasound transducer and your patient. The ultrasound transducer generates a sound wave. It's transmitted through the patient's tissues, reflected back to the transducer, and then those returning sound waves, or those returning echoes, are processed to form a single scan line. Now there's a few components of the scan line that I'd like to discuss, and one is depth. Depth is a function of distance to the ultrasound machine, meaning the longer that it takes to return to the ultrasound machine means it had to penetrate deeper into the tissues, and the ultrasound machine knows to place those returning echoes deep in the scan line. Conversely, the more shallow that the ultrasound wave must penetrate and reflect back, the less time it takes to return, and therefore the ultrasound machine knows to place that more shallow on the scan line. The second component that you'll notice is the brightness. And think of the brightness as the volume of the returning echo, if you will, or the intensity of the returning echo. The louder the returning echo, the brighter it will appear. The quieter the returning echo, the less bright it will appear. So a more intense returning echo will appear brighter, and a less intense returning echo will appear darker. Well, this same process happens again to form another scan line. And this repeats in a sequential fashion to form a 2D image. Now, in this 2D image, you can pick out the individual scan lines. And that's because it's an old ultrasound image of a fetal skull. But in modern ultrasound images, you will no longer be able to see the individual scan lines. It will appear as a homogeneous 2D image. But the image is still generated in the same fashion. So now that we understand how an ultrasound machine works,
So I hope you guys caught up to that. It's quite an easy principle once you get the hang of it. But at the end of the day, it's important to know these things before you actually start using the machine. So he's giving an excellent explanation. I love this video. I hope you guys will enjoy it too. We've still got a bit of a way to go. Sorry, that's my fault. Let me get it back up.
electrical energy.
Sorry about that, guys.
Other way. This
My
to
fault.
on machine
I take
goes
full
to place,
responsibility.
and therefore is the
Just trying.
the individual scan lines that will appear. How an ultrasound machine works. Let's return to our discussion of ultrasound physics. As we touched on before, as the speaker pumps in and out, it generates sound waves. Well, how does it really do this? Well, as it pumps out, it compresses air molecules. And these areas of highly compressed air molecules are called compressions. And as it goes back in, it creates this vacuum effect. And there is areas of low pressure called rarefactions. And with this alternating in-out movement, it creates alternating compressions and rarefactions. And for this course, we will illustrate compressions as a sound wave, like this, and the space in between them as rarefactions. So for us to discuss the characteristics of a sound wave, it's much easier to depict the compressions as peaks on a sine wave, and the rarefractions as troughs on a sine wave, although we understand that a sound wave is not a sine wave. But the first characteristic of a sound wave we want to discuss is the wavelength. And the wavelength is the distance between a peak and a peak and a trough and a trough. And similarly, the time between a peak and a peak and a trough is called a period. So wavelength is a function of distance, and period is a function of time. The next characteristics we'll see is the amplitude. An amplitude is the height of the peak of a sound wave, or how high pressure the compression is. This is the loudness or the intensity of the sound. So the higher the amplitude, the louder the sound, or the more intense the sound. The lower the amplitude, the less intense the sound is. And then lastly, we'll look at frequency. And frequency is how many sound waves travel past a certain point in a certain period of time. And frequency is measured in hertz. And hertz are cycles per second. So the more waves that pass a given point in a second, the higher the frequency. The less sound waves that pass a given point in a second, the lower the frequency. Okay, well, to make sure we understand these characteristics of sound waves, I want to do a few examples. So we're going to compare these various sound waves. And if we compare the top wave to the middle wave, we'll notice the wavelength of the top wave is longer compared with the wavelength of the middle wave. Therefore, since the wavelength is longer, the frequency is going to be lower. And therefore, the pitch of this sound wave on top will be lower than the middle wave. If we look at the amplitude of the top wave compared to the middle wave, however, is lower. Therefore, the volume or the amplitude of the top wave will be quieter than the volume or amplitude of the middle sound wave. And the bottom wave has an even longer wavelength, therefore a lower frequency, and it also has a lower amplitude than both the above waves. So therefore it will be lower and quieter. And if you look at this, you'll notice a key concept, that frequency is inversely proportional to wavelength. Meaning, the bigger the wavelength, the lower the frequency. And the smaller the wavelength, the higher the frequency. So what does this have to do with diagnostic medical ultrasound? Well, it primarily boils down to these concepts of resolution versus penetration. Now, resolution simply is how pretty your picture is, how defined and detailed the ultrasound image is. Penetration simply is how deep the ultrasound wave is able to penetrate into the patient's body and therefore generate an image. And these things are primarily a function of frequency. See, as you increase the frequency, you improve the resolution. And as you decrease the frequency, you decrease the resolution, or the resolution gets poorer. Now, the converse is true of penetration. As you increase the frequency, you decrease your ability to penetrate into the tissue. And the opposite is true. Where you decrease your frequency, you actually increase your ability to penetrate into the tissue. Now, if this doesn't make sense or seem too abstract, let me give you two illustrations. One is in photography. In the age of smartphones all having cameras, many people know that the camera's resolution is rated in megapixels. So the higher the megapixel on your camera, the better the resolution is, or the prettier the picture will be. But as you know, if the object you are trying to take a picture of is a far distance away, your resolution decreases. You've all zoomed in on your smartphone when the object is far away and the picture gets all grainy and you can't see it as well. It's because the better the resolution is when the object is closer to you. Or another illustration would be in music. You've all driven by a stadium concert. And when you're half a mile away from that concert, you can actually hear the bass. You don't hear any of the rest of the music. You just hear those very low frequencies. It's because those low frequencies, those large wavelengths, can travel a long distance. They can penetrate very well, but they're not well defined. You can't hear the detail of the low frequency. Where if you were to go into that stadium and put your ear right up against the speaker, it would be the high frequencies that pierce your ear because they're very well defined, but they cannot travel a far distance. All right, well, that wraps up how an ultrasound machine works and the basics of ultrasound physics. Next, we will look at the interactions of ultrasound in.
Okay, guys, so I hope everybody understood that. It will come into play as we do the next lectures. I must be honest, when I first started doing ultrasound as well, the physics of it and the knowledge, all very boring. I used to fall asleep watching videos like this and go back and watch again simply because it's an abstract thing. We're not physically doing it. So I'm not going to spend more time on it. For example, there is another lovely video that these guys do about particularly with the tissue and things like that. But what I will do is in the explainer courses, just give you a brief overview. Because at the end of the day, my job is not to turn you into an ultrasonographer. My job is to turn you into somebody who can see what's happening in an emergency department. Okay. However, take these lessons in. The simple reason being, it makes it easier for you to understand what you are seeing on that picture. So on the next one, we're going to discuss eFast, and we're going to go through the liver itself, and we at least start learning how to do an eFast. So I hope everybody enjoyed that. It's not one of the most stimulating lectures that we have, but I hope it at least gave you some indication of how we start to look at ultrasounds. Okay, guys. So I'll keep on posting these catch-up lectures, and hopefully we'll all benefit from it. Okay, bye.